Hi. Welcome to my short video on preparing for liposuction. Before receiving any of the procedures, no anticoagulants should be taken for 2 weeks before the surgery, if general anesthesia or sedation will be used, and the surgery will be in the morning. Fasting from midnight the night before is required. If only local anesthesia will be used, fasting is not required. Smoking of tobacco must be avoided for about 2 months prior to surgery, as nicotine interferes with circulation and can result in loss of tissue. In all liposuction methods, there are certain things that should be done when having the procedure. The candidate and the surgeon will agree ahead of time on exactly which area will be treated, and both will discuss what outcome to expect. A consent form is signed on the day of surgery. An antibiotic will be given about an hour beforehand, or afterwards. The targeted areas are marked on the body while the candidate is in a standing position. Sometimes photos will be taken of the area to be treated, so the patient will have before and after photos in the operating room. A sterilizing solution, such as Betadine, is applied to the relevant areas. Local anesthetic is injected, and the patient may be given a sedative, either orally, or through and for injection. Incisions are small, about 1/4 to 1/3 of an inch. The patient will probably have an for fluid line, since they will be losing fluid with the fat, and the fluid balance must be kept intact. There will be some monitoring devices attached to the body to keep track of the blood pressure, heart rate, and blood oxygen level. The patient will feel only a scraping or rasping sensation from the cannula movement. Usually the patient can get up, walk around, and go home the same day if they did not receive general anesthesia, although they would need someone else to drive them. Recovery. Depending on the extent of the liposuction, patients are generally able to return to work between 2 days and 2 weeks. A compression garment which can easily be removed by the patient is worn for 2 to 4 weeks. This garment must have elasticity and allow for use of bandages. If non-absorbable sutures are placed, they will be removed after 5 to 10 days. Any pain is controlled by a prescription or over-the-counter medication, and may last as long as 2 weeks, depending on the particular procedure. Bruising will fade after a few days or maybe as long as 2 weeks later. Swelling will subside in anywhere from 2 weeks to 2 months, while numbness may last for several weeks. Normal activity can be resumed anywhere from several days to several weeks afterwards, depending on the procedure. The suctioned fat cells are permanently gone. However, if the patient does not maintain a proper diet and exercise regimen, the remaining fat cell neighbors could still enlarge, creating irregularities. Health benefits. Whether or not liposuction provides the health benefits commonly associated with achieving weight loss through other means is a matter of debate in scientific circles. Mainstream doctors agree that liposuction does not help to combat obesity-related metabolic disorders like insulin resistance. Side effects. A side effect, as opposed to a complication, is medically minor, although it can be uncomfortable, annoying, and even painful. Bruising can be painful in the short term, and should fade after a few weeks. Swelling should subside gradually over a month or 2. Scars will vary in size depending on the particular procedure, and should fade over the weeks. Scarring is an individual thing, partly dependent on heredity. For some, scar healing may take as long as a year. There could be various factors limiting movement for a short while, such as wearing a compression garment, keeping the head elevated, temporary swelling or pain. The surgeon should advise on how soon the patient can resume normal activity. Possible complications. As with any surgery, there are certain risks, beyond the temporary and minor side effects. The surgeon should mention them during a consultation. Careful patient selection minimizes their occurrence. Their likelihood is somewhat increased when treated areas are very large or numerous and a large amount of fat is removed. During the 1990s there were some deaths as a result of liposuction, as well as alarmingly high rates of complication. By studying more and educating themselves further, surgeons have reduced complication rates. A study published in Dermatologic Surgery found that the overall clinical complication rate was 0.7%, the minor complication rate was 0.57%, and the major complication rate was 0.14%, with one patient requiring hospitalization. The more serious possible complications include allergic reaction to medications or material used during surgery. Infection. Anytime the body is incised or punctured, bacteria can get in and cause an infection. During liposuction, multiple small puncture wounds are made for inserting the cannula, that can vary in size depending on the technique. Sometimes the cannula can damage tissue beneath the skin, which may show up as a spotted appearance on the skin surface. Skin necrosis is a rare complication, in which the skin falls off in the necrotic area. The problem can vary in degree. The resulting wound then needs to heal, typically requiring extended wound care. Puncture of an internal organ. Since the surgeon cannot see the cannula, sometimes it damages an internal organ, such as the intestines during abdominal liposuction. An experienced cosmetic surgeon is unlikely to puncture any internal organ. Contour irregularities. Sometimes the skin may look bumpy and or withered, because of uneven fat removal, or poor skin elasticity. Not all patients heal in the same way, and with older patients the healing may be slower and a bit imperfect. Sometimes a small touch-up procedure can help. Also, in OWL, the heat from the ultrasound device can cause injury to the skin or deeper tissue. Lidocaine toxicity. When the super wet or tumescent methods are used, too much saline fluid may be injected, or the fluid may contain too high a concentration of lidocaine. Then the lidocaine may become too much for that particular person's system. Lidocaine poisoning at first causes tingling and numbness and eventually seizures, followed by unconsciousness and respiratory or cardiac arrest. The cosmetic surgeon should give the participant a written list of symptoms to watch for, along with instructions for post-operative self-care. Please click my link below for more details. Bye.